Hello and welcome to this live session today on ICL Surgery. I'm Dr. Tushar Grover. I am the medical director and a consultant in cataract, cornea, and refractive surgery at Vision Eye Center. So, today we are discussing an important topic. ICL surgery, as most of you would know, is a form of refractive surgery, a surgery which you do to remove spectacle power. And a lot of people are full of questions about this surgery because this is not as commonly discussed, or there's not as much information available on this as LASIK surgery, for example. So a lot of people who are advised this surgery have a lot of questions, have some concerns. So we are addressing those today so that you are completely aware and you're well informed on this surgery, what it is about, what it does, who are the right candidates, and what are the benefits as well as the potential risks associated with ICL surgery. So let's start. And we are going to take up questions that are frequently asked. We will allow you to ask questions as well, and we'll be happy to address these questions. If after the session as well you have any queries or any doubts that are unanswered, please comment, and we'll be happy to address those in a subsequent session, or just get back to you via the comment section itself. So, the first question that's been asked is, what is ICL surgery and how does it differ from other vision correction procedures like LASIK or PRK? So, ICL surgery is a surgery in which an artificial lens is placed inside the eye. This lens is placed in front of the natural lens that your eye has. So, the natural lens is not disturbed, but this lens, another lens, is placed in front of it. This differs from other vision correction procedures like LASIK or PRK in the sense that there is no laser involved. In LASIK or PRK, the cornea, which is the outermost transparent layer of the eye, undergoes a laser procedure so that the shape of that part of the eye is altered, and that removes your power. In this, the mechanism is different. The cornea is not touched, there is no laser done on the cornea. Instead, a lens is placed inside the eye, which is placed in front of the natural lens of your eye. So, this is how this procedure is different from the other vision correction procedures like LASIK or PRK. Do we have another question? Okay, so the next question that we have is, who are the ideal candidates for ICL surgery? Are there any specific requirements for someone to be eligible for the procedure? So, some of the requirements that you have for ICL surgery are similar for any refractive procedure. For example, you must be above the age of at least 18 years. Your refractive error, your power should be stable. You should not be having any associated problems in the eye, like, for example, having a weak cornea, having a retina which is unhealthy. Your pressures in the eye should not be high. You should not be suffering from glaucoma. All these are requirements which are usually common for any refractive surgery. Specifically for ICL surgery, the ideal candidates would be somebody who has an adequate space inside the eye, because you are placing a lens inside the eye, right? So it is measured in terms of the anterior chamber depth. The anterior chamber depth should be more than 2.8 millimeters. And this is assessed when you consult your treating surgeon. This is assessed using a variety of instruments, such as the biometers that are available. There are topographers available which give us this measurement. And this is one of the most important criteria. Other than that, the dimensions of your eye are also looked at, which is measured using a parameter called white to white. So again, this is measured using 3 to 4 different instruments, and even using a manual caliper, a manual digital caliper, and based on that, the sizing of your lens is determined. So each lens that is ordered is specific to you, is specific to the measurements that have been taken for you by a treating surgeon, and therefore these measurements, etc., are extremely important. So these are the essential requirements and the specifications that we look at before we consider someone for ICL surgery. Okay, so we have the next question. The next question is, can you explain the step-by-step process of ICL surgery? What can patients expect before, during, and after the procedure? So like I said, when we evaluate somebody, Before we advise ICL surgery, there are certain parameters that are looked at. We look at how healthy the cornea is, if the space inside the eye is adequate, if the dimensions needed for the ICL surgery to be done are adequate. Based on that, the patient is advised the surgery, the lens is ordered, and once the lens is achieved, the surgery is performed. We usually don't perform both the eyes on the same day, so there'll be a gap of 2 to 3 days between, say, the right eye and the left eye surgery. The surgery is relatively straightforward. There is a small entry made into the eye, and then there is some jelly that we use, which is filled inside the eye. The lens is implanted, put into its place. The jelly is washed off, and the eye is closed. So the procedure is relatively straightforward. You are advised medication that you need to be using after the surgery for about 4 to 6 weeks. It's important that you do not let any dust or water enter inside the eye for at least a week. And visual recovery is usually quite fast, takes a few days to about a week, and the outcomes are extremely good. Patients are usually extremely happy because many of them have had a very, very high power, and they've not been able to see anything without their glasses for their whole lifetime, and suddenly they're able to see extremely clearly. Most of them are able to see the last line. Most of the patients have vision which is better than what they had even with glasses. So it's an extremely gratifying surgery when you see the outcomes. The next question we have is, what are the potential benefits of ICL surgery compared to traditional contact lenses or glasses? Okay. So ICL surgery is most commonly done in patients who have an extremely high power. Many of them have powers as high as -15, -20, even higher than that. And these are patients who have not been able to see clearly at all without glasses, and even with glasses their vision is compromised. So when you place a lens inside the eye, which is the ICL, their quality of vision improves dramatically. They are able to see usually even better than what they were seeing with glasses, and they are able to get complete freedom from spectacles. So these are the important benefits that you have, because if somebody has a small power, say -1, -2, they're still able to manage their routine activities without glasses. But for somebody who has an extremely high power, they are absolutely almost disabled without their glasses. So glasses is something that they need to carry all the time, something they need to wear all the time. So to be able to get rid of that dependence is extremely helpful, and it changes the quality of life of these patients quite considerably. Okay, so the next question that we have is, are there any risks or complications associated with ICL surgery that patients should be aware of? Great. So this is a very good question and an important question. Any surgery, any procedure that you undergo on the human body does involve some risk. If no surgeon should ever say that a procedure is 100% safe or there is 0% risk involved, because that is not true for any surgical procedure. So similarly for ICL, you do have potential risks involved, like for example, slightly early formation of cataract is a possibility. There is a slight possibility of pressures in the eye going up. There is some possibility of damage to the corneal cells. Any surgery also has a small risk of infection. So all of these are potential risks that are associated with ICL surgery. Of course, having said that, the chances of serious complications happening after ICL surgery or any refractive surgery are extremely low. So they are essentially very, very safe surgeries with the risk profile being low. Therefore, of course, you should discuss with your treating surgeon the benefits and the risks involved in your particular case, and then take an informed decision before undergoing ICL surgery, or for that matter, any form of spectacle correction. The next question that we have is, how long does the recovery process typically take after ICL surgery? Are there any restrictions on activities during this time? So the visual recovery is usually quite fast, within a few days. In some cases, a week or maybe slightly longer than that. Patients are completely comfortable. They are able to see extremely clearly, and visual acuity, clarity, etc. is extremely good very soon after the surgery. The restrictions that I recommend are that you should not let any dust or water go inside the eye for a week, because there has been an incision and entry made into the eye. So that takes a few days to seal completely and heal completely. Till then, we do not want any source of infection going into the eye, which is why I usually recommend my patients to not wash their face for a week, take a bath from below your face, and after a week, you can get back to all routine activities and start living a routine life. Of course, medication, like I mentioned, should continue for about 4 to 6 weeks as per the routine that has been prescribed to you. Okay, so the next question that we have is, what kind of results can patients expect in terms of visual acuity and clarity after undergoing ICL surgery? So, usually the results that you get in terms of visual acuity, in terms of clarity after undergoing ICL are extremely, extremely good. Most patients are able to see even more clearly than they did with glasses. And because the glasses are placed in front of the eye, whereas the ICL is placed inside the eye, the clarity is extremely good. So, visual results from ICL surgery are usually extremely good. So the next question that we have is the ICL a permanent implant, or can it be removed or replaced if necessary in the future? Okay. So the ICL is a surgical procedure. You are placing a lens inside the eye. So you do not wish to remove it for any routine reasons, but it is replaceable. It is reversible. So if for any reason the lens is, you know, creating a problem, causing rise in pressures, or if there is a mismatch in terms of sizing, or if the individual at some point of time later in life develops a cataract, or for any other reason, the ICL can be removed if needed. So you don't usually need to do that. Very rarely do you ever need to explant or remove an ICL that has been placed inside the eye, but it can be done. And most commonly, it is done when at an older age the individual develops a cataract, which happens to everybody after a certain age. Okay, so the next question is, are there any age limitations for ICL surgery? Is it recommended only for a certain age group? So the only age limitation is that you should be above the age of 18 years of age. You should not be younger than 18 years. And your power, your refractive error should be stable, because if your power has not stabilized, say you have a power of minus 15 and we place a minus 15 power ICL in your eye, and your power increases by another minus 2 or minus 3 diopters later on, then you might get that minus 2 minus 3 power, which is why we always ascertain and make sure that the power has been stable, and only if the power has been stable do we consider an ICL surgery. Again, it can be done at a later age, any age, but somebody who's approaching the age of developing a cataract, say they are 55, 60, 65 years of age, then ICL surgery may not be the right option. The right option may be to remove the natural lens of the eye and then place an artificial lens. But the essential limitation is that you should not be under the age of 18. Okay, the next question is, can ICL surgery correct both nearsightedness and farsightedness, or is it more suitable for one specific type of refractive error? So as long as the space inside your eye is adequate, both nearsightedness and farsightedness, as well as astigmatism, which is the cylindrical power, can be corrected using the ICL. However, at the age of 40, when you start developing the need for reading glasses, which is called presbyopia, that need for reading glasses at the age of 40 will still be there, even though you have an ICL which has corrected your power previously, because that is a different mechanism. And therefore, it does remove all kinds of refractive errors, but your need for reading glasses at the age of 40 will come whether you get ICL or you don't get ICL. Okay. So the next question is, how do pre-existing eye conditions such as astigmatism affect the suitability of a patient for ICL surgery? So this is a very important question, and this also is a little technical. Astigmatism can be of two types essentially. There is what is called regular astigmatism, and there is what is called irregular astigmatism. So this is something that your surgeon will ascertain when they do the requisite scans needed to decide on whether you're a good candidate for ICL or not. If the astigmatism is regular, if your cornea is healthy, astigmatism can be completely corrected and treated with ICL. However, if you have irregular astigmatism, which happens in some conditions where your cornea is not healthy, where your cornea is irregular, such as keratoconus, You might have heard of it. We've discussed that a few times as well. So in those conditions, there are limitations. ICLs cannot be used in all cases with those conditions, and if they are used, they cannot correct the power fully. There might be some amount of residual astigmatism that might be there in those specific cases. Therefore, if you do have astigmatism, discuss with your treating surgeon. If you have regular astigmatism, you're a good candidate for ICL. If you have irregular astigmatism, then it is important to discuss with your treating surgeon what your expectations should be. Okay. So the next question is, what should patients look for in a qualified and experienced surgeon when considering ICL surgery? Okay, excellent question again. So I think what is important is that you should be aware of the hospital, the doctor that you're going to. You should have done enough research that they are a refractive surgeon who are specialized and trained in refractive surgery, which is essentially the surgery to remove spectacles. Other than that, it is a matter of trust as well. How do you expect your follow-ups to be? How do you is that surgeon going to be with you through the follow-up visits, and going to you know keep taking care of your eyes even once the surgery is done? So go to a surgeon that you trust, go to an eye hospital that you trust, and of course verify the credentials, verify that they are qualified refractive surgeons, and do these kinds of surgeries frequently. Don't fall for small things like a free workup or a complimentary checkup, or discounts and all those things, because most reputed practicing surgeons will not be offering you those kinds of things, and therefore go based on trust and not based on offers. Okay, so the next question is that, are there any lifestyle factors that could impact the success of ICL surgery? For example, do certain professions or hobbies pose any challenges? Okay. So essentially, lifestyle factors don't really matter too much in ICL surgery because the lens is placed inside the eye. So minimal trauma or minimal rubbing of the eye, they are not going to cause any displacement for the lens. The only thing that we look for is that any refractive surgery, whether it is LASIK or ICL, you do sometimes have night glares. Sometimes you have some halos around light when you're driving at night. So somebody who is a professional, for example, professional driver, professionally needs to do a lot of activities at night. So those people, you sometimes do want to discuss these minor issues. These issues are minor in most patients, but if somebody is, say, an occupational night driver, these slight glares, halos around light, etc., can become more significant, and that is why these are the important things that we consider when we plan ICL surgery. And therefore, if you do any of that, if you're a professional night driver, it's important that you discuss these factors with your surgeon as well. Okay. So the next question is, can you share some patient testimonials or success stories related to ICL surgery to provide real world perspectives on the procedure's outcomes? Okay, great. So I think this is a very good question, and I'm sure we can ask some of our patients to share their feedback of how they feel after ICL surgery. But just to summarize, we do ICLs quite often in patients, especially with very high powers, patients who are not suitable for LASIK surgery, and it really really changes the quality of their life because they've had high powers, they've had a lot of difficulty constantly needing their glasses, and even with glasses their quality of vision is not that good because of the high power that they have, and it really transforms their life when they get the kind of quality of vision that they get after ICL surgery. But of course, sharing patient testimonials is a great idea, and I think we should do that and probably post that on our social media as well. Okay. What advancements or innovations have been made in the field of ICL surgery in recent years? How have these developments improved the procedure? Okay. So again, excellent question. So one of the most important advancements that have been made is, now with the current generation ICLs or the other phakic IOLs that come, there is a central opening in those phakic IOLs. So that reduces the chances of pressures going up considerably. That reduces the chances of cataracts developing. So the complications have been minimized to a great extent. And of course, with time, our understanding of the ICLs, our understanding of other phakic IOLs has improved tremendously. So we are even more aware of which individuals are the right candidates, and if there are some individuals who are not ideal candidates, we are able to catch them at an early time. We have extremely good equipments that are available now to do the measurements that we do. So our power calculations, our sizing calculations of the ICL are even more precise, and that is what has made ICL such a safe surgery, and a surgery which gives you extremely good visual outcomes and has extremely high patient satisfaction rates. So I think that's all for today's live session. So just to share a final message and a summary. So ICL is a surgery to get rid of spectacles. It is most commonly offered to patients who have a high power or patients who are otherwise not suitable for LASIK surgery or other forms of laser vision correction. And in this, a lens is placed inside the eye to correct your power. It is a surgery which provides extremely good visual outcomes. It is overall quite a safe procedure, and it is important that you discuss about ICL surgery with your treating surgeon and discuss the benefits and the minimal risks associated with it. But overall, I think ICL is a more recent development than LASIK. It has probably been around for a decade or a little longer than that, but it has really dramatically improved our ability to give patients with spectacles freedom from spectacles and give them extremely good visual outcomes. So thank you for joining us, and any questions that you have, you can leave it in the comments and we'll be happy to address that. And if there are any other topics that you would like to cover, any doubts that you have, any issues that you face in taking care of your eyes and you would want answers to those questions, we would be happy to address those in one of our live sessions. So thank you.